our previous videos, and if you've watched some of our videos, you know who I am. Today, I wanted to discuss some patients that have walked into my clinic lately. Here in Hyderabad and in southern part of India, it's raining. Rains have taken up and streets are filled up with a lot of water. And that brings us to our topic today, monsoon related joint pains and why does this happen. So in the past 1 week from different parts of the city, I've been receiving patients from all age groups. There have been 20-year-olds, there have been 30-year-olds. I have received some 80-year-olds as well, presenting with common symptoms such as joint pains, larger joint pains, and these joint pains were not existent prior to their falling sick. All of them had one thing in common. They either had some kind of gastric problem, some kind of gastroenteritis, some kind of pain in the stomach, some had diarrhea, some loose motions, and most of these patients have had this infection that got cleared in the last 1 week, and soon after that their joint pain started appearing. So this is a classical case of post-viral arthritis or reactive arthritis is what we call. So in this condition, what actually happens is there are certain bugs that have been identified. Okay, these bugs are generally transmitted when you don't wash your hands after using the toilets. So I made a printout so that you understand. So this is, did you wash your hands? A very important thing in transmission, disease transmission. So the bugs start from the toilets, okay? And the other very important thing to remember is raw eggs can also carry salmonella. So if you're watching news lately in Hyderabad at least, a lot of street hogs, a lot of street vendors are being raided by authorities, by the municipal corporation and food authorities, that they're not attaining adequate hygiene standards, and that's because they're storing some raw ingredients, mostly with egg. The mayonnaise is implicated in a lot of gastrointestinal problems. You have diarrhea after having a shawarma. Shawarma has a lot of mayo in it. You have burgers in which a lot of mayo is slapped between the two breads. So the eggs, raw eggs, can carry salmonella. Salmonella is the causative ingredient, causative organism rather, in diarrhea. So all of these different, chlamydia is one, Yersinia is one, Salmonella, E. coli, all of these can cause gastrointestinal problems where you have loose motions, you have pain in the stomach, and these organisms, these specific organisms, have something called as molecular mimicry, meaning our body, we have different tissues, okay? You have tissues on your joints, your eyes, and everywhere. So these structures on these and the structures on our tissues are quite similar. Our immune system will cross-react, meaning, now let me just break that down with a simple example. There is a street, okay? And middle of the night, there is one very bad guy who has come inside a home or an establishment to rob something. He's wearing a black shirt and long hair. Okay, the street dogs now know that this bad guy broke into someone's house, got arrested. They remember by the smell, they remember by the appearance of this person. Next day, following day, a normal person, normal individual is walking on the same street wearing a black shirt and black long hair. The dogs start barking. Very similarly, in our immune system reacts to our own body tissue, thinking that it was that organism. Now, it's very different from an active infection. The infection goes away, but the body is still reacting to it because it still thinks that the infection is there and starts eating away our tissues. Are these? You have conjunctivitis in your eye, you have urethritis and arthritis, meaning conjunctivitis in the eyes, you have redness in the eye, you have urethritis, you have painful, when you go use the toilet, it's very painful, you pass urine, it's very very painful, burning sensation. And then you have arthritis, wherein the lining of your joints, the soft tissue inside the joints, starts getting attacked by our own immune system. And this is all to a reaction to an organism that came in your body during the monsoon. And how am I linking this to monsoon? Now let's come to that. Monsoon means there is water, there is rainfall, there is fresh water, and one such mosquito, sorry, the it's there on the screen, okay. Anyway, we're back. So one such mosquito is implicated in this. The chikungunya that causes a lot of body pains, fever, you get rashes, is all carried by a mosquito. This breeds in fresh water. So wherever you see stagnant water, the eggs are laid by this mosquito and they start breeding. So in monsoons, these mosquitoes carry the viruses. That is one mode of transport. The second one is, if you're having food outside, pani puri example, there are water droplets that are on the covering, fall into your food. That may carry some bacteria. And personal hygiene, someone who is selling you food must also wash their hands. So that's another very important mode of transmission of these bacteria. So these two have to be controlled in order to stop this transmission. So what happens as a result of this? You get these infections, body starts fighting them, you take a bunch of antibiotics, you get well. But soon after that, the reaction starts. So you have these three classical symptoms. This is called together a collective term called as reactive arthritis. Okay, reactive arthritis is a very dangerous consequence. It starts eroding your joints. Now what we do, where do we come in as pain physicians, is we identify some of the symptoms. Based on those symptoms, we just get a broad diagnosis. Okay, fine, this is secondary to some infection that may have happened earlier. And we do an ultrasound at least for the larger joints. Now I'll tell you an example of my last patient. She's a 24-year-old who walked into my clinic, who's had the same similar type of symptoms, red eye. She had an episode of urinary tract infection 2 weeks ago, and then started presenting with severe joint pains that was not going down to any kind of tablets. She was taking paracetamol, she was on some diclofenac, horrible tablet by the way. She was on that. Some maniac gave her those tablets. I don't know who that was. I don't want to talk about that, but then yeah, bad stuff. That wasn't working for her. So I got her to my clinic, and the ultrasound examination was done. What I found is a collection of fluid in her knee joint. That had to be aspirated, and I put in a needle and brought out about 20 ml of that fluid, and it was straight up reactionary fluid. It wasn't the normal joint fluid that we normally have. It was all because of a reaction, and that immediately gave her a little bit of relief. And as a therapeutic agent, I injected her with a very low dose of steroid, and after about a week, she came back. She gave me a call actually, and told me that the symptoms have gone down significantly. Then now going ahead, I put her on a few anti-inflammatory medications, mostly natural ingredients, and definitely she followed up, and she's doing well currently. So this is how it progresses. So don't forget to wash your hands. This is an important thing, to wash your hands and stop the transmission of monsoon problems. Second is to clear out all the puddles of fresh water wherever is there. Most Bengaluru in Hyderabad right now, it's raining, and so make sure the water is all cleared, the drainage is cleared, the pipes are cleared, the water is not stagnating anywhere. So a direct consequence of that, you can avoid reactive arthritis and protect our loved ones. So guys, if you have any questions, I just want to quickly go through some of the questions here. Anything related to pain, guys, just Mr. Dishant Rana official Gox up. Thank you so much, Dishant. Thank you. And how are you going out with me to do this with what? I don't understand what you mean by that. All right. So guys, I might end this live stream right now. I'm running into one consultation soon. She must be here, must be in the registration room. I just got a little update on my computer here. So I'll see you soon, guys, and do leave a comment in the comment section if you'd like to hear about any such problems that we generally see. All right, good day. Bye.